connect climate change and healthcare.
It's always been about protecting people.
As good stewards of the environment and also solving their water shortage issues.
Green energy is one path that's well worth taking.
I learned early on that you pay close attention to what the nurses have to say.
Hi everyone, welcome to the fourth podcast of Truth, Courage, and Solutions, in which we discuss Indigenous ways of living and climate solutions. I'm your host, Riley Pennington. Last podcast, we heard from Autumn Fisher and George Blair, who both have experience with algae-based water treatment systems. One of the 9 planetary boundaries that we explored in the second episode is biochemical flows of nitrogen and phosphorus. The algae-based water treatment systems help to decrease nitrogen and phosphorus to levels that support the ongoing health of our ecosystems. In this episode of the podcast, we'll be discussing Indigenous ways of living and the solution in which we can utilize to better our environment and climate. We'll be joined by Dr. Teddie Potter, Autumn Fisher, and Tom Thompson, who is a sustainability specialist for UW Health, the health system of the University of Wisconsin-Madison, which is comprised of 7 hospitals and more than 80 clinics. UW Health's commitment to environmental sustainability is evidenced by efforts to reduce energy consumption, shift towards renewable energy sources, reduce waste, and increase recycling. Tom Thompson brings more than 14 years of healthcare sustainability experience to his role at UW Health in Madison, Wisconsin. Tom previously led sustainability initiatives at Gunderson Health System here in La Crosse for more than a decade. He has extensive experience working with regional sustainable foods, recycling, medical and hazardous waste reduction, staff engagement, and community service and leadership. Tom personally enjoys working with many diverse cultures and incorporates those experiences and knowledge in his everyday life and work. In this episode of the podcast series, you will hear expert Tom Thompson discuss the efforts to reduce energy consumption, reduce water waste, and increase recycling. The term Indigenous refers to individuals who essentially lived off of the land with the mindset of nothing goes to waste, and in turn had their own circular economy. Teddie Potter talked a little bit about the Indigenous perspective regarding planetary health.
Every action, every decision is made with the 7th generation in mind. That wasn't just some nice little, gimmicky sales job. That was a core aspect of their thinking of, sure, I can take all the fish today, but what will it mean for 7 generations from now? Sure, I can cut, all these trees and perhaps build a stronger building for myself, but what will it mean for the 7 generations? And I think we need to remember, not learn that way of thinking. It's deep in our bones. I think we need to remember that to ask that question.
Teddie Potter provides solutions that focus on us just trying to live consciously.
I am trying to live as closely as I can with respect to the land. I don't beat myself up if I forget my reusable bags when I go grocery shopping and have to take a paper bag. I don't beat myself up. I'm just trying to live consciously.
A huge solution proposed by Autumn Fisher is not flushing pharmaceuticals down the toilet. Your toilet is not your garbage can. The only thing that should be going down the toilet is toilet paper, not feminine products or wipes that are labeled as disposable.
I mean, another thing that wastewater treatment plants are facing is having to monitor and treat for and remove these emergent contaminants. And it's extremely difficult because those pharmaceuticals become dissolved in the water, and anything that's dissolved in solution becomes much more difficult to take out. The wastewater treatment plants are designed to take out solids and particulate. They're not designed to take out things that are dissolved in solution. So I think it's more fundamental than just being a healthcare issue, and I think that's probably a good place to start, and just making sure that there's awareness within the healthcare industry not to flush those things and, to properly dispose of materials. But I think it goes beyond that as well.
What are some practical ways people can reduce the burden on water pollution? I know you talked about it a little bit already, but I guess if you were talking to people that worked at a hospital or just people on the street just living their day-to-day life, maybe they don't have anything to do or they don't have any previous knowledge of this, what would be your advice?
Yeah, number one advice is your toilet is not a garbage can.
Tom Thompson, the sustainability specialist at UW Health, talked about how they have worked on reducing their use of disposables and provide solutions by working with energy conservation.
Were there any big takeaways that you had from the COVID pandemic that would help us in any future pandemics?
For sustainability, I would say we learned that there are a lot of items that can be reusable that, we tap into now, and we're looking at more opportunities for reusable items so that it's not so disposable and so that you can have a ready supply on hand. Linen is a good example. There are a lot of single-use devices that are now being, and have been for actually a long time, been reusable, be reprocessed and brought back in. But I think more infrastructure and more resources were put into that so that we can have more reusable options. Some of the things, for infection control reasons have to be disposable. I mean, we just have to accept that, and work with it, and then find other ways to kind of counter that impact.
UW Health has also worked with suppliers to reduce pharmaceutical waste.
What we really try to do too is decrease. So we work with pharmacy on decreasing dosages, so if consistently docs are asking for 10 mil of a specific drug and we're purchasing 50 mil, and then that 40 ends up getting wasted every time. So we work upstream, we work with the suppliers and say, hey, yeah, we really need that 10 mil because we rarely use 50 all at once. And we really don't want to waste all of that. So we want to size correctly. And that goes broadly with things that we purchase in healthcare. So we work upstream to try and reduce the amount that we're consuming. And then what we do have to dispose of, we dispose of properly. So we work with supply chain, we work with procurement all the time. We engage them, we work with pharmacy, we incorporate infection control in some of our decision making too, to make sure that, we're safe for the patient, safe for staff, but maybe not having to use double gloves all the time. Use it when it's necessary, but not when it's really not required. Because if we do that first, then it's much less that we have to dispose of. It's much less that, could potentially go into the environment. And so that goes broadly across the health system. We're always looking for opportunities to reduce. And the same goes for energy. When we're purchasing medical equipment, we're looking for medical equipment that doesn't require all the energy draw that, some of the historical equipment did. So it's a lot of work upstream to try and prevent it from happening before it even happens.
Tom Thompson stresses the importance of education and how a layered system of education has proven to show the best outcomes. Layered education consists of huddles, their own intranet, emails, and face-to-face interactions.
We have, huddles, we have all kinds of different ways. We have our own intranet. And what we found is it's important to layer that everywhere. During the pandemic, we were actually very limited on how we could message to staff because the pandemic messaging took priority, as it should. That was fine. So even though we're in the middle of a pandemic, I went out and I worked with nursing. I worked with environmental services. We did waste audits. We did waste assessments, and we would go look at things and talk to people in their units, in their spaces, in their departments. Mm-hmm. And what we found was that was the most effective way to actually clean up the recycling and get things back on track. It was the most effective way to get our pharmaceutical waste program not just running, but running better. We, even during the pandemic, had a 34% decrease in hazardous pharmaceutical waste by volume by doing that, by kind of meeting people in their space where they work and getting things done. So as as much technology as we all have access to, it's still a human business. We're still in the people business in healthcare. And that goes for the staff too. Nurses care a lot and they want to do the right thing. And they also have exactly no spare time to be reading all these emails or all these things that are going on the internet. But if you go meet them in their space and you talk to them, oh man, things get done. You can get a lot done that way. So it's a lot of time and effort and getting around, but it's also what I enjoy doing. So, I have a lot of street cred with the nurses because during the pandemic, I didn't go hide at home. I was out working among them and taking some of the same risks they were doing the work, and they really, really appreciated that.
Mm-hmm. Yeah, I think that's a good point to reiterate because with the pandemic, there's a lot of good things that came out of it in terms of development of technology, but realizing that sometimes the most effective way to have change and education be brought about is still by going to the departments, meeting people face to face. Although, like you said, it's more time consuming. If it's more effective, it should be able to hold out in the long run.
Absolutely. Absolutely. It's, you have to layer it. And I also, we work with different departments and we put out articles on our own intranet so that people could reference about the recycling, about the pharmaceutical waste, about the initiatives that we're working on. And it's good to have that because then the nurse managers and the leaders, you can send them links to that and they can include that in their huddle notes and they can actually read it off for their staff because they know they don't have time to do that. And so layering is very important, but that person to person or person to group of people communication is invaluable, and especially in sustainability because people they really do care. They want to do the right thing. And if you go show them and then give them the why is this important? Why do I need to segregate in all these different colored buckets? And then when you explain to them that pharmaceutical waste is going to an incinerator to be destroyed appropriately, and infectious waste actually gets heated to a high temperature, gets shredded, and it goes in the landfill, two very different disposal methods. And they look at you and they go, oh, wow, I didn't know. I'm like, well, now I just empowered you. So please share with your colleagues.
Tom emphasized that education isn't just a one-time event. He and others working in sustainability at UW Health provide ongoing, hands-on education to hospital staff regarding proper waste disposal.
And then how we do it, we do safety rounds, we do environment of care rounding, and we also do waste assessments where we specifically go out and look at the waste streams. And then it's never a gotcha when we find things that are wrong. It's a teaching moment. It's an opportunity to help correct things. And so if you approach it in that manner, if you approach it as an opportunity to improve, then people don't, they don't see you coming and go, oh no, here comes the safety and sustainability, you guys. But if you keep it simple, it's best. And then have very consistent messaging. Don't have one area like pharmacy speaking differently to it than safety. We have, by segregating appropriately, that's how we're protecting the environment. We want our nurses to be safe. We want them to go home to their families as safe and intact as possible. Most of the people I work with in healthcare sustainability approach it the same way.
Finally, Tom Thompson provided some tips for becoming more sustainable at home.
Energy conservation, same thing. Switch out your light bulbs, get LED light bulbs. They're actually pretty cheap, especially in Wisconsin. If you go to the right aisle, Focus on Energy has a lot of light bulbs at even local hardware stores that are really cheap. You just have to ask where they are. And then purchasing, think about what you're buying. Think about, do you really need that? Food waste is such a big topic right now, and it should be, because in the United States, we waste more food, I think, per capita than anywhere in the world. And that, to me, that's kind of disgusting, because part of my work many years ago, I ran a homeless facility in Colorado, and making sure my folks were fed was a big part of every day. And we would take food donations. And so I think about that, and you think about, do we really need that? Do we really need all that extra packaging too? If you can buy in bulk, helps a lot. Do we really need those extra 5 pieces of clothing that just look good? Or can we wear the ones that we have, that are perfectly fine? So consumables is a big opportunity, I think, for all folks in this country. Think about it. Do you really need it? And do you have enough food? Can you finish what's left over in the refrigerator before you buy more, so that you're not wasting it? Those are big impacts. And if everyone did those things, it would have a huge impact. It's like in healthcare.
There are so many simple ways to lessen our environmental footprint, both in the workplace and at home. Those little things like bringing reusable shopping bags to the grocery store. They might not seem very monumental, but it's up to us to do our part in whatever way we can. We hope that this podcast can be informative and has gotten you thinking about ways that we as individuals and communities can play a role in promoting this planetary health. We'll close with one final quote, which is attributed to Chief Seattle. "Only when the last tree has died and the last river has been poisoned and the last fish has been caught will we realize that we cannot eat money." If you are hearing this message, you've listened to the entire episode, and for that, we thank you from the bottom of our hearts. We also want to extend our gratitude to our guest speakers who contributed so much to our understanding of climate-related health issues. The music you hear is Wanderlust by Scott Buckley, found on SoundCloud, promoted by Freestock Music Attribution 4.0 International CC by 4.0. A special thanks to Ayana Elizabeth Johnson and Katherine K. Wilkinson for their inspiration and guidance through their 2021 book, All We Can Save. From them came the framework for this podcast series, Truth, Courage, and Solutions. Turbo University also gratefully acknowledges that it stands on lands and amidst waters stewarded by the Sioux, Sauk, Fox, and Ho-Chunk peoples. This has been an academic project of the Turbo University's Direct Entry Masters of Nursing Science students, 2022 through 2023 school year.